Well, where we're sitting today is MD Anderson Cancer Center, Orlando. We're an affiliate of MD Anderson Cancer Center in Houston, and we're a subsidiary hospital of Orlando Regional Healthcare.
To discharge a patient in today's world of healthcare, you have generally 4 or 5 physicians on the case. You have to have their approval. All of them have to write orders, see the patient, give prescriptions. And then you have discharge teaching that the nurses have to do. Pharmacy has their input, physical therapy, all the ancillary departments are involved in a discharge also. So between the time spent on the phone and gathering information, this could take several hours.
We've tried many different things to have patients discharged. Cajoling the physicians, speaking to the nurses. How can we get this discharge time down so we can admit patients? As we looked at this, we said this has to be embedded in some technology, some reproducible way, some measurable way that we can start to do this.
The use of cell phones and the use of our interactive voice response technology from Nortel sort of became the option of choice. At that point, we realized that we would not be able to do this completely on our own.
When we first approached Nortel with our idea, I think they matched us step for step in terms of the creativity they brought to the table and their willingness to try new things and to look at things in new ways.
The nursing staff now does not have to make all the phone calls. This system, what it does is we put the order in electronically. It calls the attending physician. If they say yes, it cascades down to all the consultants. It also is helping us get these patients out earlier because the chaos and disorganization of trying to get all these physicians together in one day has been alleviated.
Our typical patient discharge time had been right around 6 p.m. We were able to push that forward 4 hours. If you parlay that into a system-wide benefit, the cost savings is enormous, and so is the opportunity.
The response of the doctors from the technology side has been one of easy acceptance.
I was very apprehensive about putting something new on the nurses' plates. But once we started doing it and kind of embraced the whole technology, which is something new for nursing, they've come to like it, and they're actually putting the orders in on their own without being reminded because they see the results.
Well, as we look at where we invest in information technologies across the health system, we're always looking for opportunities that address financial concerns, quality concerns, patient safety, and efficiency. And this particular endeavor actually touches on all 4.
We all talk about this healthcare crisis with a fixed and shrinking amount of money, an ever-enlarging patient pool, not enough doctors, not enough nurses. I think the salvation for many healthcare systems will be in process redesign and careful automation. And we really saw Nortel's hospital discharge application work in that way here, and I think those benefits would translate to benefits in any healthcare system.